And that, by the way, just know that is one of the side benefits of doing hypnosis of any kind with anybody. They're going to have improved sleep. Hypnosis really is the epitome of integrative medicine. I love that term, integrative medicine. That's become my new favorite. I'm okay with complementary. I like integrative even better because it means we're actually working with the rest of the team, the medical team. It's basically an introduction to why hypnosis obviously is quickly becoming the go-to modality in integrative medicine. It truly is. It's a prelude. This is also a prelude to the Medical Hypnotherapy Specialty Certification Training, which Novella was a part of last year. And that was developed by me many years ago and now has contributions, of course, by the wonderful Dr. Eric Rosen. And it's now approved through the International Medical and Dental Hypnotherapy Association. More to come because we need more. Everybody that was in the medical hypnosis training this year said the same thing that they said last year. There aren't enough trainers out there. All the ones I had are gone. So we got to get some more people out there doing this stuff. So what is the role of the medical hypnotherapist? By the way, when you graduate, you don't have to go take the medical hypnotherapy training in order to work with medical issues. This training prepares you more than anything else out there, I'm convinced. The people that were in my medical hypnosis training this year, none of them trained originally with me, and everything I taught them was new to them. They didn't get anything on pain relief in their original. They didn't get the stuff that you're getting in here. I'm realizing people around the world are not necessarily getting that in their basic hypnosis training. So you're going to be well qualified, is my point, to accept doctors' referrals and work with people for migraines, for sleep issues, for pain relief, for cancer, for anything that you're comfortable with, that you can help them. Side effects of chemotherapy, pre and post surgery preparation, all the things we get more detailed into in the medical hypnosis, you will have the basics of already how to work with those people. And again, there's nothing that limits you other than your creative imagination, so it's unlimited. Today's well-trained and experienced medical hypnotherapist is perfectly positioned to play a pivotal role in collaborating with licensed professionals, because integrative medicine is the new normal for the 21st century. This is, it's here now, and it's exploding right now. Hypnotherapists have the unique advantage of being the experts in this valuable specialty that integrates mind, body, and spirit. Hypnosis by design addresses underlying issues related to the symptoms and therefore is able to achieve longer lasting results. The data is in, the research is out there now. We can say these things. Hypnosis enhances and amplifies the positive effects of other treatments. And the only side effects of hypnosis are positive ones. No one else can say that. No one else can say that. We are unique. So the healing paradigms, just oversimplified obviously, but the old paradigm was treat the external cause. The new paradigm is discover the real cause beyond the physical. The old paradigm is practitioner does something to you or puts something into your body, right? The new paradigm is looking within the client for deeper, lasting healing. And again, it doesn't mean we don't still do the other things, you know, may be a place for all that other stuff too. It's integrating it to make sure there's deeper, lasting healing. The old paradigm, what's broken and how can we fix it? The new paradigm is what's being called for to attain balance. It's a whole different thing. Pretty cool. The goal of medical hypnosis, physical, emotional, and spiritual wellness. The WHO, which now everybody knows what WHO is, don't they? World Health Organization. When I first started putting this on there, I had to explain it to people. Don't have to anymore. According to them, which in this case I think has a lot of credibility in this context at least, health is complete physical, mental, and social well-being. Now that's a modernized version of health, isn't it? This is really the way the medical community works with people now. Physical is, of course, nutrition, movement, exercise, sleep. Mental, self-care, love, optimistic attitude, relaxation, stress release. And social, healthy interactions, setting boundaries. Sound familiar? the ability to say no, and that means to yourself too.
Mm-hmm.
So, physical, mental, and social, guess what? Hypnosis can help with all of these, can it? So the doctor has a heart patient that he wants him to start exercising. Guess what? We may not work with them on the heart issues. We can work with them on exercise motivation. We can work with people on better sleep. We can all these things in the physical. Also, we can work on helping their attitude, helping them to learn to relax, to release stress, teaching them how to care for themselves, giving them confidence. Socially, we can help people learn to set boundaries. We can help in every single area of health, in other words. Medical hypnotherapists can assist with all of these areas, making them an indispensable member of the healthcare team. It's our job to inform the doctors of all of this science and data now, and to get them to realize how valuable we are to their team. It's our job to educate them. National Institutes of Health, the NIH, they have an arm, by the way, if you're not familiar with it, the NCCAM, the National Complementary and something alternative medicine. I forget what it means, but anyway, NCCAM, the acronym is, and it's a part of the National Institutes of Health. If you want to do research on some of the complementary and they call it alternative as well, but some of the complementary and integrative medicines and research and data and peer-reviewed studies, NCCAM, part of the NIH, you can find studies for anything you can imagine. This is just a quick overview, just showing how many people are looking to complementary and alternative medicine. Now, this is way back in 2010, so this is 10 years ago already.
Totally different.
But it was, look at the age groups. I mean, the lowest percentage is 24% for those over 85 years of age, and I'm sure that's gone up. Because people 10 years ago that were my age now, they're all used to doing all these complementary things. So that group, I'm sure, is way above 24% now. But 10 years ago, you know, up as high as 40, mid 40%. And again, I'm sure all of these are well increased at this point. Because this is when it was just starting to really surge in the early, what do you call it? Early 2000s? Early 2000s, yeah. Back in the old
Sounds
century,
weird.
we didn't know about all this stuff.
Oh, that stuff.
Okay, and you've seen this before, but it bears showing you again because this gets people's attention, especially when you got to show that we used to always have this in hypnosis trainings years ago, because this has been around for a long time, reported in 1970, for heaven's sakes. But they used to only show those percentages up there. They never would. So I added his face. Looks like a 1970s face to me. And then I added the source, because you know what? When you're talking to doctors, they want to know, where did it come from? What's the source? So this was from Psychotherapy magazine, not Hypnosis magazine, but Psychotherapy magazine. Tells you the volume, the number. Alfred Barrios is the guy that did this. And this, I looked him up a couple years ago. I was doing some more research for the medical hypnosis because I wanted to know more about where'd they come up with these numbers I've been hearing for years and years and years. You know, every hypnosis class talks about these. So I started doing more research on him, and I found all kinds of stuff. And his work that he did with working with cancer with hypnosis, and he's got a lot of stuff out there. But anyway, this was also published in American Health Magazine and Psychotherapy Theory, Practice, and Research and Practice. Anyway, 38% 600 sessions for psychoanalysis, 72% 22 sessions. That's success rate for behavioral therapy. And you could add cognitive behavioral therapy into that category. And also, you know, mindfulness, all those wonderful psychology things that take it to a certain level. But once you put in the hypnosis along with all that, which is, I think of hypnosis, somebody said it the other day, it's like combining hypnotherapy and cognitive behavioral therapy because it is so conversational. And by the way, CBT stole, I'll say borrowed, they learned from what hypnosis was discovering when Milton Erickson got into hypnotherapy and started doing the conversational, the permissive language. And CBT was formed out of that. They literally took what hypnosis had learned about conversational change work and they incorporated it. So really, it's all hypnotherapy. 6 sessions, 93% success rate. There you go. 1970. Hello. Here's my little chart that I made up. And this only has, it doesn't have near all the little modules around the sides, but medical hypnosis is in the middle because it is the nexus of integrative medicine. It does combine, well, I should say, all of these other things have combined little pieces of what we know in hypnosis. And if you take all of what they discovered, I've got in there mind, body, medicine, health psychology, positive psychology, mindfulness, all psychoneuroimmunology, all of these things. And like I said, there's a whole lot more of them that it would have be too big of a chart, but that's a little capsule of what's out there. They all do a little bit of what we do, but we do all of it. We do all of it. We've got everything that's good about what they've discovered in what we do, because they took it from hypnosis anyway, from the world of hypnosis. So we're the link, we're the nexus to integrative medicine. We are the indispensable team member. So think of that when you talk to doctors, and act like that when you talk to doctors, and educate them in why that is a fact, because it is. Working with medical diagnoses, just to remind you, the diagnostic code, see, hypnotists don't diagnose. So why is it important to know something about the Diagnostic and Statistical Manual, the DSM? 5, they're on 5 now. And the reasons are it enhances your credibility. You don't have to know every diagnosis or what it means or every drug or any of that. You just have to be familiar enough so you can carry on an intelligent conversation with those doctors. It gives you credibility, professionalism, understanding your client's needs and challenges. It can help you with treatment directions. It can help you with knowing if they come in with a diagnosis of just something common like anxiety. It can help you to know what questions to ask to get the information you need to do the hypnotherapy intervention that you're going to do with them, and to create the outcomes as well. The second reason is it promotes clinical conversations with the referring physicians, psychologists, psychiatrists, and other medical professionals. Remember, we as unlicensed hypnotherapists, which they all are, can get referrals from anybody who is a licensed healthcare professional. In the Florida Statute 485, it talks about healing arts practitioners. We have to have a referral from the appropriate healing arts practitioner. That's their word for it. Now you're in North Carolina, right? Or South Carolina?
I am in North Carolina.
What is it? I'm sorry.
I'm in North Carolina.
North Carolina, yeah. I'm not sure in North Carolina. I know there's a lot of hypnotists there. So do you know what the laws are there? It's pretty much, you got to get a referral for medical, right?
I don't think they require it, but I think it's just out of ethics you would do it.
Oh, you don't think the state requires that you?
I don't think so.
So
I
would definitely check that, because
I will.
I don't think there is a state that doesn't say if you're working with pain relief, you got to have that doctor's referral usually. I can't imagine that North Carolina, I'm pretty sure it does. You're a member of IACT, right?
No, I'm not a member yet. No, I'm going to earn some money before I join.
Okay, are you a member of IMDHA?
I'm a member of NGH, National Guild.
Okay, well, I don't know if they have a virtual library and all the resources that IACT and IMDHA have, but
yes, they do.
Should be able to contact them, and they should know all the laws. And
I bet they will. Sure.
Yeah. But I would want a referral anyway, even if it wasn't required, personally, just for liability. But anyway, let's see. Reason number 3 provides a point of departure for appraisal of the client's needs, hypnotherapy treatment goals, creating hypnotherapy outcomes. There you go. Now, information is power. In the medical world, the more credibility you can build with the doctor, and doctors don't have a lot of time. They don't have time to sit and talk to you in their office. You'll be lucky if you get the gatekeeper, and the assistant, whoever's the assistant to the doctor is probably the more valuable person to really get to know anyway, because they're the one that's going to say, hey doc, this patient of yours wants to see a hypnotist, here, sign this. They're going to sign it most of the time. They're not even going to question it. So you want to get to know the gatekeeper or the assistant or the main, whatever the title is for the person in the office that takes care of the busy work, because the doctor doesn't have time for that. So how mind affects immune response. Here's a little short piece that I give out. Remember, I told you a great way to meet doctors is to do talks at little like Rotary clubs and Kiwanis clubs, those places where people with a lot of money go to, you know, do great causes and interact and network with people, right?
Sure.
There's always doctors there, medical people. And here's what I put up at the top. Remember, always have a disclaimer. If you're going to call yourself a hypnotherapist, which you will have on your certificate, Carol and Sean, when you graduate, because you will be one, you know, a hypnotherapist. Whether you use that title on your advertising or on your business cards or whatever you have is up to you, but you will have the certificate. And you'll actually have two. You'll have one from UP Hypnosis Institute, which is getting pretty well known. Oh, I can say I'm an international trainer now. This is exciting. I don't even have to leave Palm Harbor. A whole new world has opened up to me. So you'll have UP Hypnosis Institute certificate as a certified hypnotherapist. And then after I send in the stuff, assuming you both pass the assessment and do all your homework, and do all your homework satisfactorily for me, then you'll have one from the International Association of Counselors and Therapists, which is a nice big one. Okay, so I give this out. Like I said, when you're doing a talk, they don't want you to advertise. So I don't put, I bring my business cards and I keep them next to me. Because when you give talks at, you know, these kind of groups, they don't want you to advertise. And I don't want to anyway. I want to inform. And as soon as you say the word hypnosis, they get excited. As soon as they put it out to their membership that they're bringing in a hypnotist to speak, everybody shows up. They always tell me this is the biggest crowd we've had in, you know, months, because they usually see, you know, real estate people, you know, financial planners, you know, those kind of people. They're not all that exciting. They see hypnosis, they all show up. So make it exciting for them. But I'll put something like this on the table because I know there's going to be doctors there, and I know everybody there has a doctor, and I know everybody there probably has some health issues or knows somebody with some health issues. So I want to promote, because I'm a medical hypnotherapist and there aren't that many of us out there, I want to promote that. And you guys can promote this even without the title of medical hypnotherapist, because you are a hypnotherapist and you can work with doctors' referrals. So here's something I would give out, and I always put the disclaimer again, because I don't ever want anyone to think I'm replacing medical or that I'm a licensed medical professional. I'm not a doctor. I don't want to be a doctor. Okay, this material is being provided by UP Hypnosis Institute, because again, they know who I am. I've been introduced by the moderator, but I want them to understand I'm associated with an institute. That's impressive. It's all about perception, right? If a doctor reads that, they go, oh, she belongs to an institute? Oh, how cool. Okay. UP Hypnosis Institute, provided for informational purposes only and not intended to be used for medical decisions. Medical applications of hypnotherapy require an appropriate referral from a licensed healing arts practitioner per Florida Statute 485. Memorize that statute. Gives you credibility. For more information about medical applications of hypnotherapy, go to uphypnosis.com, of course. Always put your contact information. Okay, my name's not even on that part, is it? Nope. No. Because my credibility is that I'm giving them this piece of information because that's what I'm there for, is to give them information. Now, I've got from Fighting Cancer from Within. Y'all familiar with that book? Heard of it. You've heard of it? Yeah. It's an amazing book. Martin Rossman, MD. Okay, there's the credibility, right? MD. Imagery. I love this. I can't overemphasize how important these two paragraphs are and how much I put them out there. Imagery. This is from that book, Fighting Cancer from Within. Imagery has been shown in numerous research studies to affect almost all major physiological control systems of the body. Now, my only problem with that sentence is he says almost. You can't affect one without it affecting all of them. Come on. But anyway, it's still good. And it's a doctor saying this. Okay. Including breathing, heart rate, blood pressure, metabolic rate, digestive function, sexual function, and perhaps most important, immune system response. Now, the next paragraph, still from the doctor that wrote the book, Fighting Cancer from Within. A review of articles investigating whether imagery could affect you. You can replace the word imagery with hypnosis, right? Yes, that's what we're trained in, guiding them with imagery. Whether imagery could affect immune response revealed that the vast majority of 22 such studies showed significant positive results. Not just positive results, significant. They demonstrated that people doing imagery aimed at stimulating the immune response against cancer or chronic viral illnesses increased not only the number of circulating killer cells, that's the immune cells specifically charged with eliminating the cancer cells, but it increased their aggressiveness when encountering an abnormal cell or virus. Think COVID. Think COVID. This information, I'm telling you, this should give you more clients than you ever have time to see right there.
We need a copy of this.
We got to get it out there. I will send this to you.
Okay.
When the system, let's see here, cell or virus. The level to which immune responsiveness is increased with imagery is significant. Again, that word significant. When the system is stimulated by imagery, there are no adverse side effects. Any side effects actually tend to be positive. A greater sense of calmness, empowerment, and feelings of wholeness. This is powerful stuff. This is powerful stuff. And then at the bottom, because I'm handing this out, I'm putting this out for the people, you know, what they don't, and I just put it in a stack in the middle of the table. And when they're gone, whoever picks them up, I figure wanted it. If they didn't, I pick them back and take them back home with me. I don't hand one to every person. I don't hand every person my business card. I make them come up and ask me for it, you know. So that means they're truly interested. But by the time they hear you talk, they're going to pick this up. If you supply them with some additional information, and like I said, have your contact information on there. And here you go down at the bottom. Now I've got my I've got the references here. International Journal of Neuroscience. Okay. Fighting Cancer from Within. This is not from a hypnosis journal. This is powerful stuff. These are the kind of things I like to hand out. It doesn't have my company name even on it, I don't think. Well, yeah, it does, UP Hypnosis Institute. I'm going to put my company name. I don't have my name even on here, I realized. I don't need it. They're going to come up and ask me for my card, or if they go to uphypnosis.com, if they're really interested, they're going to see me. I'm the president. That's me. Okay. So, pretty cool, huh?
Yeah.
So use your time wisely and get out there and talk to people. The minute you start talking, and I always leave about half the time for questions, because that's when you can really get them excited by making it personal. And trust me, they always have questions. Okay, since we're talking about cancer a lot, can you see that?
Yes.
This is just a little short article I did about cancer many years ago. Advantages and benefits of hypnotherapy as an adjunct therapy. That's another nice word. You know, you're working in coordination and in, you know, connection with the medical community. Adjunct therapy for cancer patients. One area where vast research shows that the obvious virtues of learning auto-hypnosis, which is self-hypnosis, of course, can be so pronounced and dramatic as to be indisputable in any venue. There's a stigma that had been attached. No, this is long time. This is probably from the 1900s. The 1900s. Boy, am I dating myself here? It is 2020 already, isn't it?
Yes.
The 1900s is 20 years ago. Good Lord. Okay. A stigma that has long been associated with cancer, more so in the like 1960s and 70s. When a doctor told you you had cancer, 50s, 60s, and 70s, we called it the big C. That was the term, because there wasn't a lot of great treatment back then. We got a lot of treatment now. It has a little different feeling. So it would strike fear in people, you know, contracted what came to be known as the big C. Yeah. Partially because of this very stigma that people began to explore complementary and alternative therapies, because there just wasn't much out there that was very helpful. The the treatment that there was, and a lot of the treatment they're still doing, is not very enjoyable, and a lot of it's not very effective, unless you go to somewhere like the what's the one? The American Cancer Institute, is that the one? And MD Anderson now they bring in hypnotherapy and all these things now. So they're starting to get better, a lot of them. We can help it speed up by getting out there in the community, putting ourselves out there. Frustration at the limitations and negative side effects of traditional therapies, along with the development of a more proactive approach and attitude toward dealing with the disease, led to a new acceptance of using hypnosis in this area, because doctors started noticing that patients that were more proactive and involved with their treatment and with their, wanting to get, that had their attitude about wanting to get well, were doing better than their other patients, right? Whatever the evolution process that brought us to this era, all cancer patients and physicians alike can benefit enormously by incorporating a more holistic approach to this area of medicine. Now, proven and measurable benefits of hypnotherapy for patients diagnosed as being oncologic. Improved mental attitude, number one. Research indicates a proactive, that's what I just said, proactive positive attitude actually can inhibit the progress of the disease. That's important right there. If you only did that, help with their mental attitude, which we do. In the first session, they already feel better walking out the door. So you're already helping them to fight the disease better. Improved immune response, now a little more direct, right? Direct suggestion under hypnosis has been shown to have an effect on the immune system that could lead to the body's natural rejection of cancer. Now this says direct suggestion. I would add, I wrote this years ago. Now we know that permissive, indirect, metaphorical processes also can help the immune system. I think sometimes even better. So do both. Why not cover everything? Diminished, it also helps diminishing the need for narcotic drugs. Hypnosis can raise the pain threshold. Hello, we know that, don't we? By using glove anesthesia, post-hypnotic suggestions, misdirection of attention, etc. There you go. Also, reduced discomfort to radiation therapy. The Hilgard's Hedge and the Simonton's studies and the whole bunch of other ones that are out there, they all have reported a better tolerance to radiation therapy using, also for chemotherapy. That's not in this article that I wrote, but that's also been shown. Using hypnosis to improve mental state with suggestions, imagery, auto-hypnosis, and relaxation. Gives people an increased sense of control. Patients who use self-hypnosis techniques gain an important sense of power over the disease, leading to positive physical and psychological results. We always say hypnosis is empowering. And then in this article, of course, look what I've got. That thing that I just showed you. Rossman's Fighting Cancer from Within. There's those same two, and the references are here. Kroger and Krastelnik and all those people. Here's the thing, the Simontons. Now here, I have another article by someone that I picked up on the internet somewhere years ago. And I picked it up because he was talking about these Simonton studies from the 70s. And in there, he mentions that he was introduced to the studies at the American Board of Hypnotherapy conference in California, Newport Beach, California. And my radar went up because I said, that's where I saw him too. I was there. He was actually, Carl Simonton was at the convention presenting. Now, I didn't know who he was, and I'd never heard of the book at that point. And I'm sure that's when I ran out and got my first copy. This is about my fifth one. Somebody found this at I think it was at a garage sale, because I kept giving them away or letting somebody borrow them, and they'd disappear through the years, you know how that works. But he was there. So he was at the American Board of Hypnotherapy presenting because he knew that he was doing hypnosis with these people. That's what it was all about, imagery. So pretty powerful tools you have in your toolbox. I'm doing this to get you to realize that more. Okay, this is a project to change the attitudes, beliefs, and practices of health professionals concerning hypnosis. This is what I'm talking about, educate the medical professionals. They actually did a project. Now I found this just this past week. So this is a new piece. I'm gonna add it to the medical hypnosis training too. American Journal of Clinical Hypnotherapy, which is one of the most respected out there. This is from 2003. I'm amazed I hadn't found this before. Okay. University of Vermont did this project. This is a really cool project. I love this. Study describes an educational project designed to change the beliefs attitudes and practices of healthcare professionals concerning hypnosis and hypnotherapy. I thought, how cool, they actually did this. So the purpose of the study, of course, was to investigate whether an educational offering that dispelled the myths and misconceptions of hypnosis, that offered a historical perspective, that discussed how hypnosis works therapeutically, and elucidated the many medical uses of hypnosis, can change the attitudes, practices, and beliefs of healthcare providers. Now, doesn't a lot of that sound like what we're doing with our client at the beginning of the session?
Mhm.
Yes. We're helping to change their beliefs and expectations. They did this with medical people. I love this. So they gave workshops to healthcare professionals at a variety of venues. 3 questionnaires were used to collect data from study subjects before, immediately after, and then 3 months following the educational intervention. I love that they called it an intervention too.
Mm.
The results indicated that it is possible. It is possible with a 90 to 180-minute lecture on hypnosis to create changes in beliefs, attitudes, and practices. That's what the project was. So in that short talk, they actually were able to do this. When the healthcare professionals have accurate information on hypnosis that is substantiated by scientific research, they're more likely to believe that hypnosis has a place in traditional mainstream medicine and to suggest self-regulatory strategies in hypnosis to their patients. This is so simple. So go talk everywhere that they'll bring you in to speak. An educational presentation on hypnosis can encourage healthcare professionals to learn more about this modality and to seek training in hypnosis. And of course, when you go out and speak and someone says, gee, how can I get more training in this? What are you going to say?
Up hypnosis.
Ah, thank you. Thank you very much. So this is what I've been telling students to do for years. Now, there's actually a study where they did this. They experimented and they showed in a short talk, you can change people. You can change those medical professionals by giving them information, facts, dispelling the myths of hypnosis. You've got to give them accurate, scientifically proven data, which is what I'm showing you some pieces on here today. Yes? Like it? I talk about Bruce Lipton a lot. He was a professor of cellular biology at Stanford University. No slouch. He wrote a book, the first book that I was aware of, The Biology Belief, was written after I, again, was first introduced to him where? The American Board of Hypnotherapy Conferences in Southern California, Newport Beach, California. I saw him there every year, and the first year that I saw him there, he was on the board of directors for a long time of the American Board of Hypnotherapy. Because I remember reading his bio going, what's a cellular biologist doing at a hypnosis conference? Why is he involved with hypnosis? Well, he told us. What he studied in stem cells, he's done extensive research. By the way, nowadays, he has a whole bunch of really cool stuff on YouTube. You can find little short and a lot longer interviews with him about he's got several books now. When I was seeing him at the American Board and going to his seminars, he hadn't written any books yet. He has at least 2 books now, The Biology Belief, which is what I heard him talking about all those years. And he has another one after that called The Honeymoon Effect. Interesting name. He's a wild and crazy hippie from the 60s era, you know, a little bit of a hippie guy. So he's about my age. And just phenomenal. He's brilliant and he's a little crazy, which I think is a nice combination of things. How Mind Affects Body. There's his name, The Biology Belief. And again, see, I give this when I give talks. Here's my little disclaimer. It's exactly like the one on the other one. So again, this just, if people take the time to read it, or even if they just glance at it, increases credibility. It's all about perception, remember. If they think you're some hypnotist that's out there just doing goofy stuff, and if they still have that impression, which they shouldn't have once you start talking anyway, but they're just gonna toss it aside, most people. So you want to give some credibility. So here's a quote from The Biology of Belief. Our new understanding of the universe's mechanics shows us how the physical body can be affected by the immaterial mind. Thoughts, the mind's energy, directly influence how the physical brain controls the body's physiology. Thought, energy can activate or inhibit the cells function, producing proteins via the mechanics of constructive and destructive interference. So back to what we know and what we've always known before we had the cellular proof that he could show in a test tube, or that they could show in a wonderful brain scan nowadays of how the mind and brain work when we think a thought. We always knew that where the thoughts go, the body follows, right? Someone who worries all the time and is negative all the time starts to manifest within the very cells of the body some repercussions of that.
Right.
And if that's possible, then you also have to accept that if you send those same thought energies in the positive direction, it's going to have the opposite effect. It's going to have the healing effect. And there's Martin Rossman again. So this is another piece. I expanded it. It's usually one page. Same thing. I just combined the two. And then I've got Bruce Lipton's info at the bottom and the two from the previous one. So depending on who I'm talking to, I might throw in, because biology, you know, it's showing that this is science. This is not just anecdotal.